Senate Republicans are saying one thing about the new health care bill. Democrats, of course, are saying something else. So who's telling the truth? President Trump says the bill continues Obamacare's coverage of pre-existing conditions, but there's a catch.
And it's that catch that is causing so much controversy. WBZ political analyst John Keller is here tonight with a truth test. John.
Yeah, Liam, Paula, you could call this debate in part a battle of TV personalities, with late-night talk show host Jimmy Kimmel, father of a child born with serious medical issues, challenging the claim of the president and others that the so-called Graham-Cassidy bill really does preserve coverage for those with pre-existing conditions.
I'm sorry, he does not understand. Under Graham, Cassidy, Heller, Johnson, more people will have coverage, and we protect those with pre-existing conditions.
Oh, I get it. I don't understand because I'm a talk show host, right?
So who's right on this core health care issue? The bill takes existing Obamacare funding and turns it over to the states in the form of block grants. Co-sponsor Lindsey Graham.
In the block grant to the states, we mandate that every state shall cover pre-existing illnesses with affordable and credible care.
But states can seek federal waivers from the law that bars insurers from jacking up the cost of coverage for those with pre-existing conditions, who tend to be more expensive patients. All they have to do is show in some undefined way that the coverage is, quote, adequate and affordable. And as health insurance expert and founder of the Mass Health Connector, John Kingsdale, explains, even a generous state like ours might be under intense pressure to curtail that coverage. In essence, who had it right, Jimmy Kimmel or Senator Cassidy?
Oh, absolutely. Jimmy Kimmel had it right. Yeah, for sure.
How so?
Well, one way or another, most people are going to find a return to underwriting practices and benefit designs. So even if you can get coverage, you're going to have to pay so much that they're not going to be able to afford it in a case where you have a child with congenital problems and huge medical bills.
Now, another concern of Mr. Kingsdale's, it took Massachusetts 4 full years to get so-called Romney care up to speed. He should know he was there. The new Senate bill gives states barely 2 years to revamp their approach. Good luck with that.
And it's a very complicated system. 2 years might not be enough. So at this point, does the GOP in the Senate have the votes to pass this thing?
You know, I'm not a soothsayer or a Swami, but by all accounts, it's close.
Very close.
The backlash is certainly building. The question is there enough time between now and the end of next week, which is the deadline for a vote, for the backlash to have the same effect it had earlier in the year?
All right. This is the story to follow. John Keller, thank you so much.
It's big.
Thank you, John.